After an operation, the wound has to be closed, and there are many different ways of doing it. One of the ways was by using a basic straight needle like this one here. The reason why it's so large is because we only put a few stitches in. And the reason why I put a few stitches in with big gaps between the stitches is so we can use tents, which are rolled up pieces of bandage that would go in between the stitches to keep the wound open, to allow the bad elements to escape the wound. We believed the badness was inside the wound and had to come out, not outside coming in. Another way of sewing a wound together was bringing skin and muscle down together over the end of a stump, for example, and then you'd pin it like that, and you put another pin that way, and then what you would do with a figure of 8, you would go round the two ends of the pin, and that would keep the skin and muscle together. Each day you'd clean the wound out, you'd leave the pin in place, and you'd make the figure of 8 tighter and tighter and tighter to draw the skin and muscle together. Sometimes you had to keep a wound slightly opened, or you'd disfigure the skin. So if you had an open wound and didn't want it joined together, what you would do, you put a tube in the wound that way, and then the needle could go through the tube, like so, and that way you can then sew loosely fitting stitches. Another way of doing it is quite nasty, is using pins like this one here. You'd actually pin one side of the wound, and you'd pull the wound over, and you'll stick it in the other side. Not very nice, but a way of closing wounds. If you had extreme facial cuts and you were a lady, and we did any of those methods, what would happen is you'd have horrific scarring. So what they've done is they got pieces of material like this here, cut into what we call dragon's teeth. This would be stuck to each side of the cut, like that, and then you'd sew the points together, and that way the skin is brought together and you do not get the same sort of scarring. We have here 3 different types of thread. We have gold wire, which would be used in hernia operations, because the gold wire will stay in place inside the body, and the idea being is it wouldn't cause infection. Most commonly we'd use linen thread. Linen thread was used for most things in different thicknesses, or we could use silks. Now you note the silk is red. We don't use black thread because the black colour has got oxidized dyes in with metal in them, and they would rust and rot the thread, so you wouldn't use the colour black. Normally, for thicker wounds, we get the linen thread and we'd cover it in beeswax. And the idea being is it being a natural fibre is that the beeswax stops the material rotting. We now know that beeswax has an antiseptic quality to it, but at the time we didn't understand this. So this was a secondary sort of byblow that was positive for once.